This is Future Doc, the TV show. I'm Dr. James Biddle. We're doing a series of TV shows on integrative medical topics. We're going to talk today about bioidentical natural female hormones. This lecture series is on integrative medical topics that are important to you. We're looking at these from an integrative perspective, which means integrating the best of conventional medical knowledge with alternative medical knowledge. You, of course, know what conventional medicine does. It's what all doctors do. But we also want to look at what doctors don't do. When I was in training, I got exposed to a lot of alternatives that seemed very helpful, that help people beyond what I was able to do just from the conventional medical perspective. This led me to ask questions like Sherlock Holmes. How can we look deeper at the underlying causes of disease? And one of the ways we do that is we look at nature's template. We figure that nature has a way for us to work appropriately. Conventional medicine just simply gives an illness a diagnosis and then tries to figure out what's the right drug to treat that diagnosis with. In conventional medicine, we want to see where did this person go astray from nature's template? When did they start being unhealthy and how did that happen? What can we do to reverse it? And when we do that, we want to use the most natural products available, the most non-toxic ones, and preferably keep the cost down too. So by doing that, we get great results. And tonight we're going to talk about how to do that with female hormones. And so the question is, what's a natural hormone? And I guess first I should answer the question, what's a hormone? For those of you who may not know, a hormone is a chemical, a biochemical, that is produced in one part of the body and carries a signal to another part of the body. So classic examples of hormones is starting in our brain. We have an area called the pituitary gland. And the pituitary gland basically controls a lot of your other glandular tissues, which are the tissues that create hormones. For example, the pituitary gland secretes a hormone called TSH, or thyroid stimulating hormone. And that goes to the thyroid gland and gets it to make the thyroid hormone. What we're going to be talking about is the pituitary gland secreting LH, which is luteinizing hormone, and FSH, which is a follicular stimulating hormone, and those go to, in men, the testicles, but in women, the ovaries, and help those go on a cycle to produce their own hormones. So then we have the secondary hormones. In men, you have testosterone primarily, and women, you have mostly estrogen and progesterone. So that's what hormones do. Hormones then go to another part of the body and affect them. So if we have testosterone as a male hormone, that'll go to a body and give us an Adam's apple and a very deep voice that you can make deep sounds. If you have estrogen and progesterone, estrogen will help women to have their own body shape. And especially estrogen is specifically designed, as most women know, to help you store fat to prepare for pregnancy. And progesterone has its own functions to continue pregnancy. Progesterone actually means progestational hormone. So it's the hormone of gestation or pregnancy. So that's what hormones are and what hormones do. With that, what's a natural hormone? Well, when we use the word natural, what we mean is bioidentical. We mean a hormone that has the same biochemical shape as what your own body makes. Now, in truth, they're not natural. They're semi-synthetic. We don't go out into nature and find these hormones and gather them from herbs, because the molecules that are in herbs are phytoestrogens. They look kind of like estrogens. They can stimulate our cell membranes kind of like estrogens, but not exactly. They're not exactly like the estrogens that our own body makes. In conventional medicine, there's a certain type of hormone that comes from pregnant mare's urine. The trade name of that is called Premarin. So Premarin stands for pregnant mare's urine. In that, there's a hormone called equilin. 85% of this particular hormone is equilin. Well, equilin is not present in humans, so it's not a bioidentical hormone. It does work. You can give it to humans, and it will treat some of the symptoms of hormone deficiency, but it doesn't exactly fit the receptors. You know, these hormones work like a lock and a key. The receptor is like a lock, and the hormone is like a key. It lands in there. And mind-bogglingly, it will do that hundreds to thousands of times per second. It's almost like a quantum equation of a probability function of how fast this happens in vibration, of these hormones hitting these receptor sites. So you can take a phytoestrogen, and that will also hit the receptor site, but not as intensely. Or you can take an alien molecule that looks kind of like a hormone, and that can hit a receptor site. And you can do that purposefully, like a prescription drug, like Premarin, although it won't be exact, so it won't be quite as good. Or you can do it non-purposefully. There are a series of hormones that are a series of molecules that look like estrogens to our bodies. For example, the pesticides, petrochemicals, and plastics all look like estrogens to us. Why use natural hormones rather than synthetic hormones or alien other animal hormones? Well, it's because the bioidentical or natural hormones fit our receptors better, and we can metabolize them away. We have developed ways to adjust our own levels of hormones. So if I give a woman a little bit too much hormones, she has a way to get rid of the excess. If I don't give her enough hormones, she has a way to hang on to raise her levels. If we give women non-natural hormones, which unfortunately is happening in huge quantities, not only with postmenopausal hormone replacement therapy, but also with birth control pills and patches, then those often sit in the tissues for long periods of time. Rather than just sitting there for minutes or hours or days, they can sit there for weeks or months or years or perhaps even decades, stimulating those receptors, causing long-term problems such as overstimulation of breast tissue, increasing the risk of breast cancer, or uterine tissue, causing other problems with the uterus. So those are some of the problems with non-natural, non-bioidentical hormones. I have a very interesting perspective about menopause. Now, women go through menopause, and they get to about age 50 or 55, and their ovaries stop responding to the signal of the pituitary gland. So LH and FSH go sky high, and the ovaries say, I'm sorry, our telephone line is disconnected, we're offline, we're not going to respond anymore. And in fact, one of the reasons why postmenopausal women get ovarian cancer is because of this drive. They keep on getting a signal by LH and FSH to do something, and they're saying, I can't do anything anymore. I'm all done. I can't make any more estrogen and progesterone, really. And one integrative doctor who's treated thousands of women, tens of thousands of women over about 20 to 30 years, says he has a 0 rate of ovarian cancer in his practice, even though he should have had at least like 50 cases, based upon the number of women he's treated and the average rate risk of ovarian cancer. Because if you lower that pituitary level of FSH and LH by giving the right levels of hormones, then you stop that incessant drive onto the ovaries. So you can significantly lower ovarian cancer that way, potentially. Not scientifically studied and proven yet, but potentially by one doctor's report. What happens when you run out of the female hormones? Well, you start to have a lot of symptoms. What kind of symptoms do women have? Well, first of all, there's the notorious hot flashes. And the reason you have hot flashes is because your temperature regulation center right next to your pituitary gland in your hypothalamus, the part of the hypothalamus that controls the pituitary gland is right next to the part that controls your temperatures. So as you're making these big surges of hormones to try to drive the ovaries, which are no longer listening, then your set point on your temperature keeps changing. Just like when you have a fever and you take acetaminophen and your fever comes down, you start to sweat because your set point has changed. Well, that's what's happening with hot flashes. Then that happens in the middle of the night, and you get night sweats also. So this is very, very disturbing. Also, women's psyche gets disrupted. This also happens after birth. During pregnancy, women have very high levels of progesterone, the progestational hormone, and they feel great with that high level of progesterone. And that's being made by the placenta. And then after the baby's born, the placenta comes out, they no longer have progesterone, and they get postpartum depression. PMS is largely potentially caused by the drop in progesterone before the menstrual period comes on. So you get this imbalance of estrogen to progesterone going on.